medicine, a career in medicine is not a sprint, it's a marathon. And if you try to sprint it, you won't get this, you will end up struggling at some point, and your enjoyment levels will not be the same. So pace yourself. The really important thing is that those pathways that people have understood better and better, there are now drugs that target those pathways, and therefore I think learning that now as a medical student must be fascinating, because not only do you learn this complex pathway, but you then learn how these drugs affect that pathway, and you then can see the practical application.
Hi everyone, so our next guest today is going to be Dr Sheldon Cooper, who's a consultant gastroenterologist here at the Queen Elizabeth Hospital. So Dr Cooper's very kindly agreed to speak to us a little bit about his journey and also share any advice with us that, sharing your wisdom with the rest of us juniors. So if you'd like to introduce yourself, and we can take it from there.
So hi everybody, I'm Sheldon. I've been a consultant gastroenterologist now since 2009. So I came to Birmingham University Medical School in the early 90s, so I've been a practicing doctor for some time. I think I probably, if you want a bit of a history about how I got into medicine, I just found actually when I was a school child, I guess, understanding how the human body worked was just absolutely fascinating, and the scientific side of it was fascinating. But it then grew into wanting to help people as well. So it's a mixture of two things, a mixture of trying to help, and it's a mixture of trying to understand the science and understand how the human body is just a fascinating thing, how it's grown and evolved over the years. And so that's how I ended up doing medicine as such. And going through med school, it was clearly the right thing. I don't think you can go into medicine without really having a passion for understanding those things, because it's enormously hard work. But it's enormously hard work that gets you into a place where you can do what your aims were when you first set out. As to knowing what I wanted to do when I came out through medicine, that's something that grows, and it grew with me. So as you come out of med school, all new doctors have to do general training to begin with, and you get a bit of flavour of medicine, a bit of flavour of surgery. Some people go out to general practice, and you get to feel what grabs your interest. When I first started to do some of the medical specialties, I knew that both cardiology and gastroenterology, I found them very fascinating. And it was a combination of the fact that when you're looking at both of those types of systems within the body, it's not just about seeing something in a snapshot, it's about seeing something dynamic. So if somebody's got heart disease, it's all very well just taking an image of the heart or an echo of the heart, but actually you want to know how that heart reacts under stress. So you might do a stress test, you might stress it by doing physical exercise or do a chemical stress test, and you can get to know things better in that respect. And the same with gastroenterology is you're not just looking at a static disease, you're looking how that disease affects your absorption of nutrition and how it affects your general health. And it's just that interaction with so many different things which makes it absolutely fascinating.
Absolutely, and I think, as you said there, a person's interest in a particular area kind of like changes and grows over time. So what made you decide to go more down towards gastroenterology as opposed to cardiology?
Yeah, that's a very interesting one. There were several things that brought me along that way. There's a practical aspect to it for me. I don't think I was ever going to be a surgeon. I don't think I was going to be somebody who could do all of the complex surgery. I just couldn't see that being as my main focus. I like to be able to think around problems. We all, as surgeons, physicians, we all think around problems in a great depth. But being a gastroenterologist, you're doing something very practical when you're doing investigations, when you're doing endoscopic investigations, gastroscopies, colonoscopies. You're using your hands, you're working your way around problems to look and examine somebody's digestive tract in more detail. The other modalities such as wireless capsule endoscopies are very interesting, but you're not having to do the physical aspects, you're using the mental aspect. And gastroenterology is very holistic in that respect, and the fact that you've got a hands-on specialty at the same time as having something you really need to focus on, medical treatment, with all the fascinating different choices we have now for biologic therapies, for example, for Crohn's disease, different nutritional therapies we have. My subspecialty is clinical nutrition, so looking at this aspect, how it all interacts, is just absolutely fascinating. So it's the fact that it brings all these things together into one thing is just, I personally find fascinating.
No, definitely. And I know you mentioned there's an emergence of a lot of these new drugs, novel treatments. Do you feel like that's affected how training is happening now versus to maybe X amount of years ago?
Definitely. I remember immunology training, the lectures you'd have for immunology, for example, quite a lot of it was very complicated, and it was very, how can I say this without making immunology an unattractive area? I found some of it rather, dry is not the right word, but found it very academic, as in I couldn't see the relevance of it, because it's good to understand it, but how molecule Y affected molecule X, that affected molecule A, B, C and D, but that's all the information I had. But the really important thing is that those pathways that people have understood better and better, there are now drugs that target those pathways, and therefore I think learning that now as a medical student must be fascinating, because not only do you learn this complex pathway, but you then learn how these drugs affect that pathway, and you then can see the practical application. Now, I didn't see that as a medical student. I did enjoy immunology. I did find it fascinating. But I think if you've got this practical aspect now, with all these fascinating new medications which we use, not just in gastroenterology, they're there in all the specialities: skin, so it's dermatology, ophthalmology, rheumatology, hematology. All these very new medications are interacting with these pathways which we learnt as basic pathways, but now you can see how important it is with everyday practice. So I think it's becoming more and more fascinating, actually.
Absolutely, and I guess patients would want to know a lot more about them. So I guess as clinicians, everybody has to be quite clued up on how to explain the medications to the patients. The other question I had, and I don't know if this was the case when you were training, but we don't get that much information about nutrition, and obviously nutrition plays a really big role in gastroenterology or just across all of medicine. And I think just as students and other peers I've spoken to, we get a very small percentage. Can you talk to us a little bit about the importance of nutrition, and for any young scientists or young doctors, what kind of things should we be aware of to make us better clinicians?
Well, nutrition is everybody's responsibility in medicine and caring for patients. It's not just the nutrition specialists. As clinicians, in any respect, be it a healthcare assistant, a nurse, a pharmacist, a physiotherapist, or a doctor or a surgeon, if you see somebody that looks malnourished, then you've got to act upon that. Now, you may not know quite what to do, but there will be people who can help, so you need to refer on to them. And at the end of the day, we are made up of what we eat and drink. Quite simply, that's what our body structures are made of, and how we mobilise what we eat and drink. It reflects on our everyday lives, and it's the way that our gut bacteria interact with our nutrition also dictates how our gut health is. And our gut health, as we're beginning to see more and more, is related to our neurological health as well, our mental well-being. And it's some very obvious and sensible correlations you can have about if you eat certain things that you really enjoy, you feel better because it releases certain hormones in your brain. But there's certain things which we know for a fact have a more subtle impact with a gut-brain interaction. We're also seeing that what you're eating can affect your muscle growth, and the muscle affects the rest of the body. So it is a fascinating area to look into. It's an area that a lot of people claim to have expertise in. We see people calling themselves nutritionists. And you've got to be very careful, because there's no rules about who can call themselves a nutritionist. So anybody can call themselves a nutritionist. I'm going to fly a little flag for the Association for Nutrition now, because they do have a register for registered nutritionists. and there are certain competencies that you have to have and certain qualifications you have to have. If you've got that and you call yourself a registered nutritionist, then you've kind of had a seal to say, actually, this person knows what we're talking about. So it is worth thinking about that side of things as well. But dietitians are the mainstay. If you want excellent advice about how to manage the nutritional status of somebody who's poorly, somebody who's unwell, then a dietitian is 100% the right person to go to. But everybody should be able to give some nutrition advice, and increasingly, and I hope it will continue to be so, in medical schools we should be seeing an increasing amount of nutrition in the curriculum. It's something I personally have tried to promote. I know the Association for Nutrition have tried to promote it as well. I've managed to get lectures into medical school at different levels, at 3rd and 5th year here at University of Birmingham. The lecture I tend to give in the 3rd year is about understanding how to look at nutrition, how to understand malnutrition, how to identify malnutrition, and how to tackle it in the best way. And then the lecture that I've been giving in the final year of medical school has been more about how you manage nutrition in the acutely ill patient. So if they're on intensive care and very, very sick. So that, again, I think is a really, really helpful lecture that I give. But that's only 2 lectures in the medical school curriculum, and I think it's not enough, personally. I think there needs to be more. So there we go. I'll jump off the soapbox for a moment.
No, you're absolutely right. It is like a necessary part, and I think it is great that more and more is being introduced, because as you say, it is, one of the most fundamental things that goes into like looking after the patient. So the other question I wanted to ask you is, what are some of the research areas around nutrition? Obviously, there's a lot of recent research into the microbiome and those sort of fields, and like nutrition and inflammation, etc. Can you speak a little bit about that for any students who are interested in research?
Well, there's an increasing amount of research, and across all fields. I've got several areas which I've been particularly interested in recently. So I've just finished supervising a PhD thesis looking at vitamin D and inflammatory bowel disease, and it's very interesting to see how often we see vitamin D deficiency and inflammatory bowel disease. We're now trying to understand more about, we now know that we can supplement and improve not only the vitamin D status, but also we're beginning to see improvement in quality of life as a result. The questions that we're asking continue to rise from that. Why do we see an improved quality of life? Is rising levels of vitamin D associated with better response to treatment? Did the vitamin D deficiency become about because of the disease, or is the disease actually manifested because of the vitamin D deficiency? And it's a very, very complex area. And it doesn't just extend to digestive problems either. I know that my respiratory colleagues here are looking into vitamin D with regards to lung inflammation. And one of the professors at the university who I've been working with on this PhD that we've been supervising jointly is looked at autoimmune conditions being more prevalent in those with vitamin D deficiency. So the vitamin D is really, really fascinating, and there is an increasing number of research items there. Another area which is up and coming is looking about sarcopenia. Now, sarcopenia is about muscle loss, muscle wasting, and that muscle wasting can be associated both with inflammation, but also with, of course, nutrition and dietary intake. So that element is an area that's growing rapidly, and the other area which we're trying to put into this is also the microbiome. So we have a very eminent colleague who's internationally renowned with his microbiome research, and we're trying to get some of that microbiome research coupled in with the muscle wasting or sarcopenia elements of it as well, to see how these things all interact. At the end of the day, we're made of what we, I've said it already, made of what we eat and drink, and therefore, all these different things will have a bearing on how we respond and grow throughout our lives.
Absolutely. And I suppose for anybody who's, considering doing some sort of a research project and you're thinking about what kind of areas to look into, then here are plenty of suggestions for you to go and do your bedtime reading. So I'm going to just take a bit of a turn here, and usually when we have speakers on like this channel, I usually like to ask them about some of the highlights and lowlights of their speciality or their career. So would you be happy to share some of those with us?
Oh gosh. There's been so many ups and downs in my career. there's been difficult times. Passing Royal College exams was I'm no good at multiple choice questions, absolutely terrible at them, and the number of times I sort of had to endure going through Royal College exams, it was a struggle, but I've got there. So that was definitely a stressful time in my life, and indeed, I don't particularly want to put people off, but it is hard work doing research. But the results, even if you've got, I don't mean the physical results of the research, but the actually completing the research, be it with good results that show a positive correlation with something, or actually you find no correlation, they answer questions we all desperately need. So there is a satisfaction to doing the research, but it's hard work. And as long as you're up for the hard work, that's great. So those are some challenging times. Some more positive times. I've moved once in my consultant career, always being able to progress to the next level in medicine has always brought a feeling of satisfaction that I've moved on and achieved the next thing. So when I got my registrar post, that was a highlight. Then becoming a consultant was even an even bigger highlight. And I started off my consultant days in the Black Country. I've moved now to into the QE. That was a big highlight. And I think the biggest highlight so far of achievement, if we want to say about achievements, is the fact that our intestinal failure unit, our severe intestinal failure unit, now is an NHS England commissioned unit, which has been a huge battle really for about 10-11 years to have that commissioning process that we're now a unit is big. But I think the most rewarding part, especially with clinical nutrition, and I'm going to put this right at the very, very top, and it's not just clinical nutrition, it's aspects of gastroenterology as well, and aspects of clinical care, is team working. It is being part of a team. And, all of these things that I've mentioned, the NHS commissioning, the research, all of these things are not one person's activities. They're activities done by a group of people. And everybody has a role to play in it. So our nutrition team is made of nurse specialists, dietitians, pharmacists, psychologists, physicians, surgeons, and the list goes on. I'm sure I've probably missed people out on that list, and I'm sorry if I have. But every nutrition team I've worked throughout my training and through my current career, they've all just been amazing people. And I couldn't do that job without them. And the unit wouldn't be what it is without them. And the same goes with gastroenterology. There's a number of gastroenterology colleagues in our department, consultant colleagues, but we all bring something different to the table. Everything's a little bit different. We've all got different angles of looking at things, different subspecialties within gastroenterology, and we learn off each other. We've got nurse specialists, we've got secretaries, we have the GI physiologists, for example, a whole range of people, endoscopy nurses, nurses who do endoscopy. The list goes on and on and on, even down to the booking teams, the cleaning staff, the domestic staff, the caterers. Everybody helps to come together to deliver that thing for the patient. And that, I think, that's the beauty of the NHS, and that's the beauty of this career, is it's working with some hugely dedicated people.
I'm sure that's true, and I look forward to starting my clinical years soon and getting to experience some of this. So thank you for sharing that. And something else I like to end this segment on is 3 pieces of advice that you would perhaps give to either a younger version of yourself or any other junior doctors who are about to enter their clinical years and working.
Oh gosh, 3 pieces of advice. I'm on the spot now, aren't I? I think I successfully managed this at med school. It's getting a good work-life balance. It's really, really important. You can work your socks off and say, actually, I'm just going to really focus hard. I'm going to work hard to get to this goal. The problem is that once you got to that goal, there is always another goal. And then once you got to that goal, there's always another one. Medicine, a career in medicine is not a sprint. It's a marathon. And if you try to sprint it, you won't get this. You will end up struggling at some point, and your enjoyment levels will not be the same. So pace yourself. I'm not saying don't do it. That's not what I'm saying at all. What I'm saying is pace yourself and make sure that there are things in your life that you do outside of medicine, outside of the learning, and that is really, and you'll find it enhances you as a human being. And at the end of the day, when we're interacting with patients and we're interacting with colleagues, we're human beings. And if you lose that human touch because you've been so focused on working hard, it becomes more difficult to be that human. And therefore, I think it affects the way in which you interact with your colleagues and with patients, which is oh so important. That is absolutely vital. So the work-life balance is important. I think I probably lost a bit of focus on work-life balance at various times through the medical career. So it's important to keep that in check. I guess the other bits of advice is make sure that you are happy in what you're doing. You know,
very important.
You don't have to, you know, I think that one of the problems I see with current medical training is that we go down the line of you've got to choose your specialty early. I don't think that's entirely fair, and I think it's, you know, don't rush to make a decision on I want to be a neurosurgeon, or I want to be a GP, or I want to be a psychiatrist too early on. Experience all these different fields. You may find out that you might have the initial feeling, yes, I want to be a psychiatrist right at the very beginning, and actually that's what you end up doing at the end. But if you haven't experienced some of the other common areas of clinical practice, you can't experience them all. But I think making sure you keep an open mind is really important. You wanted 3. I've got to think of a third one now.
Yes, third one.
Yeah.
It's always the most difficult one.
Yeah, the last one's always the most difficult, isn't it? I've mentioned, I think it's a good thing to think about is what type of job suits you as well as a person. So a speciality might grab your interest, but if it doesn't match your lifestyle, that may not work for you. So there are certain people, I can immediately think of now a retired colleague down in Southampton who was a gastroenterologist with a big interest in clinical nutrition, but he used to do loads of expeditions. He used to go off, run off finds. He walked across Antarctica, went up Everest, and all these things with these explorers, but it matched his clinical interests. And therefore he was able to do these fantastic things together with that. Now, if he'd ended up being, say, a psychiatrist instead, that might not have matched his clinical interest. Some people, clearly family life is hugely important, and that's what they want to have a family life. And doing a job that involves huge amounts of out of hours work may not work with that. Really, you have to think about how the job that you want to go into, the career you want to go in, is that something you can live with? At one point, I wanted to be a trauma surgeon. This going back to med school, many years ago. I absolutely loved it, but I'm not sure I could have done that day in, day out. The constant high level of response to an acute emergency and running to an emergency, back, and nothing in between. It would have been, I'm not sure I would have coped with doing that in the long term. And from that perspective, although I still find that very exciting, you can't be excited 100% of the time. You will end up, in trouble there. So actually, finding that balance is the right thing. So I think all 3 of the things I've mentioned have all been about finding the right balance for you as a person. And there's only one person that can really understand whether that's the right balance, and that's yourself. But you've got to have that experience of seeing what those jobs are like.
Yes.
So go out there and experience it.
Definitely.
See what takes your fancy. See if that matches what your aspirations are. See what that matches what your life choices are.
Brilliant. Thank you so much. They were all really insightful, and I'm hoping that other people will find it as useful as I found them. Are there any final words that you'd like to share with anybody who's watching?
Do what you think is that grabs you, interests you, you enjoy, and make the most of that. It will be hard work. Make sure that, I think there's a phrase I learnt in sixth form actually, which was really helpful, and I can still remember it today. He says, desperately trying to think of it. It's resentment-free work and guilt-free leisure. And if you can manage resentment-free work and guilt-free leisure, it's a very good starting point.
I might have to put that on my wall. Thank you so much, Dr. Cooper.
That's a pleasure.
Thank you.